Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
Lately, we've all heard about the American healthcare system being broken. But what exactly does that mean? Why is it broken? And most importantly, can it be fixed? Mission Evolution Radio TV show is coming to you on the X Zone Broadcast Network and is produced by REL-MAR Media Company with studios and corporate offices in St. Catharines, Ontario, Canada. With us this hour to examine the state of American healthcare system and possible solutions is Dr. Robert Pearl. Dr. Pearl served as the CEO in Kaiser Permanente, where he led over 12,000 physicians, 50,000 staff, and was responsible for the nationally recognized medical care of 12 million Kaiser Permanente members. He currently serves as a professor at the Stanford Medical and Business Schools. Dr. Pearl is the author of 2 books on healthcare, Mistreated and Uncaring. His website, robertpearlmd.com. Dr. Pearl, thanks for joining us on Mission Evolution.
It's my pleasure to be here this morning.
Is it cold where you're at? We've got a lot of cold going on in this area.
Well, I'm in California, so compared to Toronto and Canada, no, it's not cold. But for California, it's a little chilly.
Okay, well, I'm jealous. Not usually, but today I am. So, Dr. Pearl, as a medical doctor, what did you specialize in?
I specialize in plastic and reconstructive surgery, specifically children with cleft lip and cleft palate. In fact, I'll be heading to the Philippines in a couple of weeks to do a mission trip to repair those children who otherwise would have a quite problematic life.
Oh, bless your heart. That's such important work. Have you seen more of it lately, the cleft palate situation?
No, it hasn't grown. It's very specific to different parts of the world. There's genetic basis that contributes. It's not the sole factor, but the need around the globe remains as it has. This is my 13th trip, so it remains the way it's been for quite a number of years.
All right. Well, what was it like being the CEO in Kaiser Permanente?
It was a privilege. Kaiser Permanente is a combination of an insurance company, the Kaiser Health Plan, a hospital system, and the nation and maybe the world's largest medical group, the one that I was the CEO of. And it brought together all the different parts. So rather than battling with each other, we could collaborate and cooperate. We ended up number 1 in the United States in quality, according to the National Committee for Quality Assurance. We provided care that was same day, next day, on a consistent basis to patients, which is missing from American medicine today. And it was affordable, less expensive, because better quality and more convenient access, in my view, leads to better outcomes, less inefficiency, and lower expense, greater affordability for patients.
Well, that was then, and now we're looking at something different, aren't we?
Now we're looking at a very complex world that is becoming increasingly more difficult as the cost of healthcare rises. As you're well aware, we now spend nearly $1 in $5 on medical care. In the United States, we spend nearly twice as much as any other nation. We spend $13,000 per person, with Switzerland at 9, Germany at 7, and everyone else less than half, with results, unfortunately, that today trail these other 12 nations. Longevity is 6 years behind the global leaders, and maternal mortality and childhood mortality is double what we see in other peer wealthy countries.
My goodness. Where did we go wrong? Where did we take that wrong turn?
That's a great question for which we could probably spend several days, but let me try to summarize briefly. I think it was a confluence of forces. The first one was a change in the diseases that people get. Go back to the 20th century. What did you see? You developed pneumonia, maybe you had a heart attack, you broke a bone, you had to have surgery, or you got put into a cast, or something was done to treat what I think of as an acute problem. And the physician would see you 3, 4, 5 times, depending upon the severity. And then you usually got better. Occasionally you would die. But that was the end. And what we saw starting around the turn of the century was proliferation of chronic disease. This is diabetes, hypertension, obesity, asthma. And we're seeing rates of this. 60% of Americans have one or more chronic diseases. And it's a very different problem. A chronic disease, you don't have just one day or one short episode. You have it for the rest of your life. And the demands put on the medical system by chronic disease started the problem, accelerated through greater unaffordability, and then brought the backlash from insurers and payers and the government.
When the government got involved in health insurance, what happened?
Well, the government's gotten involved in health insurance at different times. We first saw it in the 1960s. The U.S. was the wealthiest country in the world coming out of World War II. We had 70% of the steel in the world manufactured in the United States, 70% of the automobiles. The country had sufficient dollars that the government passed Medicare for the elderly and Medicaid for those individuals who were unable to pay, for their own health care. That was the 1960s. And I like to compare the cost of healthcare against what's called GDP, gross domestic production. This is the total cost of goods and services in the country. In essence, how many of every $100 that Americans spend, how much is spent on healthcare? And in the 1960s, we were looking at something around 6.5%. And then decade after decade, it went up 7%, 9%, 11%, all the way up through 2010, when it reached 17%. That's almost $1 in $5 being spent on healthcare. These are the same dollars that would be used for housing, for food, education, the roads, fire, police. You can go through all the different ways that we spend dollars, all the retail expenditures that we make. And then we saw what I think of as the peak. And I say that because the predictions of economists was it was going to keep rising to 20, 25, 30%. And it stayed at that level. And it stayed at that level, not because we improved healthcare outcomes. You know, what we saw was the government get involved again during the presidency of Obama, putting in place the Accountable Care Act, and seeing that we would now expand coverage. We got as high as 95 million Americans last year were enrolled in Medicaid. It's a program supposedly for the very poor. That's almost 1 in 3 Americans. We saw the government offering other means of getting coverage. And what we didn't see was improvement in clinical outcomes. I mean, what we saw was a flattening of that curve, but it didn't happen because we reduced heart attacks and strokes. It's because we started to skimp on care in order to avoid getting any higher.
Oh, my goodness. And I've certainly personally experienced the skimp on care phenomenon. I think all of us have. And what are the results of that skimping?
So to let viewers and listeners understand this shrinkflation, I like to call it. I realized this last year. I bought a box of cereal. The box was the same size as I'd bought in the past. After, as everyone knows, the inflation that happened during the pandemic, the price was up, but it hadn't risen from the last time I bought the box. But when I opened the box and I looked inside, there's only about 3/4 the number of flakes. So it had shrunk what was being given to me, even though it appeared I was getting the same size box at the same size price. This is what's happening in medicine. What we see since that 2010 was various ways in which, as I said, the government and insurers and payers, meaning the businesses, have shrunk the healthcare Americans get without making it obvious. How did they do that? Number one, they put in place high deductibles before your insurance even kicks in for many people. It can cost you $3, $5, $6, as high as $7,000 out of pocket. And today, 51% of Americans say they can't afford the coverage they have. Number two, they put in place prior authorization for doctors to do the things that they know patients need. They have to get approval. And
So that leaves us wondering. That leaves us wondering who exactly is running the healthcare system. Is it the doctor with all the education, or is it somebody with a high school education sitting in the insurance company approving or disapproving?
well, I'm not sure is anyone running it because calling it a system is being very generous. But what's happening is that I'd say there are hurdles that are ever higher that the doctor has to try to get over. It's exhausting physicians. 60% of physicians say they're burned out. 71,000 physicians quit medicine last year. And what ends up happening is that you come in, you need an expensive procedure, test medication. The doctor knows the battle will go on for months, so you don't get that recommendation. And certainly for the people who are relatively poor, this is a United States phenomenon. Canada has universal coverage, obviously, but within the United States, the people who are poor can't get access. Everyone has coverage. They think they have insurance, but a high deductible plan, a plan with a lot of prior authorization, a plan for which the government pays so little that no doctor wants to take it, or very few doctors want to take it. It means shrinkflation. You look like you have great coverage. The reality day to day is that you do not.
And in the meantime, the healthcare prices have been going up exponentially too, haven't they? Yeah.
Well, they have gone up, but as I said, since 2010, we have not seen it go up relative to gross domestic product. But what has happened is that the outcomes have gone down. In the United States, longevity fell prior to COVID. During COVID, it fell by 2 full years. And since then, it's still down a year.
Well,
United States longevity is no better than it was 20 years ago.
Well, it's that magic moment. We're going to have to take a station break. Dr. Pearl and I will return very shortly, so don't you go away. This is Mission Evolution, www.missionevolution.org. What happened when the doctors weren't watching? With us this hour discussing the current healthcare crisis is the author of 2 books, Mistreated and Uncaring, Dr. Robert Pearl. Dr. Pearl, interstage left after we were seeing this drop before COVID comes along. What impact did COVID have on our current system, and is it something that's driven us in a positive direction or in a negative one?
COVID exposed many things that were lurking under the surface, some good, quite a number problematic. The biggest problematic piece was chronic disease. Because in New York City, as an example, 88% of the people who died from COVID had 2 or more chronic diseases, because these weaken your body. And if we're going to try to improve clinical outcomes and make care more affordable, we have to shift from thinking about medicine as treating diseases to maximizing health. From going from simply doing something when a problem goes wrong to focusing on prevention, avoidance of complications from chronic disease. Hypertension is the #1 cause of strokes. Diabetes, hypertension together are the leading cause of heart disease, the leading cause of kidney failure. Obesity is the #1 contributor to cancer. We have so many opportunities to avoid it, and we have to maximize patient safety. We know that 250,000 Americans die every year from a preventable medical error. 400,000 people die from misdiagnoses. We have so many opportunities, and they got uncovered during COVID. The second thing, though, on the positive side, and I do not want listeners and viewers to miss this, doctors, nurses, clinicians of all ilk are very dedicated. They put their life on the line. When there was not protective equipment, they donned salad lids and garbage bags in place of gowns. They put themselves in the path of harm. They knew when they intubated a patient, the patient would cough, spewing virus in their face. This was before we had a vaccine, and they did it anyway. And we need to recognize these two parts. We have dedicated individuals working very hard, but we have a broken system, and I'll add to it contributing a problematic culture that makes their efforts unable to deliver what patients want, which is superior health, better outcomes, avoidance of complications.
And what patients need. It's pretty basic. Why did we see this drastic upswing of chronic diseases? What was that about?
Well, that's happened for a while. We can tie it back really to the end of the 20th century, 1980s, 1990s. We're not exactly 100% sure. It certainly came about by things like fast food, sugared soda, lack of exercise, difficulty finding fresh produce, a more rapid lifestyle, so that rather than preparing meals ourselves, we too often depend on someone else, and these other places have the meals full of processed foods, high calories, low nutrition. So there's a lot of reasons why it happened across the country, but the reality is it did happen. Air pollution is another example relative to asthma. So all of these different chronic diseases have environmental factors, and those environmental factors, unfortunately, they need to change. They should change. They actually contribute as much as the medical care, but they're not going to change quickly, at least based upon my reading of the political agenda, really, both in the United States and around the world. So when I look at those pieces, I think the medical profession is going to have to evolve given the problems that are outside of it, because ultimately this is where the buck stops.
Well, the doctors are suffering, the patients are suffering. Who's benefiting from this current system?
Well, there are a lot of people benefiting. I like to think of this as the conglomerate of monopolies. The people have figured out how to get market control to raise prices. A great example of the drug companies that now have drugs that are costing in the millions of dollars that could be pricing at a much lower point, but the stockholders and shareholders are going to benefit from it. You have hospitals that are forming monopolies, joining together, mergers and acquisitions to control the market and raise prices. You have private equity coming in, taking over doctors' practices and raising the cost of care by 10, 20, 30%. So I think there are a lot of people who have figured out how they can use the current system and the rules to be able to drive up prices and therefore generate income and profit. I think the losers are the doctors and the patients.
Absolutely. And it's like when the laws were made, Obamacare, say for instance, it was an attempt to make things better, but then the money greed piece seems to have come in. Is that where everything kind of went downhill?
I'm not sure. I mean, those two events happened in parallel. I think the biggest push by Obamacare, by the Accountable Care Act, was for expanded coverage, which it did very nicely. At the time, 1 in 6 Americans didn't have health insurance. For your listeners in Canada, they can't believe this because all Canadians have coverage, but in the United States, 1 in 6 didn't. And so it expanded that, but it didn't necessarily address the other issues, the underlying issues, the socioeconomic issues. And those, I think, have just been building up, at least in the United States across that time, and in some other nations as well. There's still some places in the, I'll say, the wealthier parts, the industrialized parts of Europe, Asia, Australia, New Zealand, that are doing a better job than the United States is doing.
So obviously we're kind of in a pickle here, and it looks like a pretty complicated one. Do you see what chance do we have of improving this situation in the future?
I'm actually incredibly optimistic now. And the reason is ChatGPT. And that I use that word just to really reflect the generative AI tools Google has some. Microsoft obviously has the OpenAI, the ChatGPT. Amazon's talking about it. A variety of places are bringing forward these tools. We've known for a long time. You can actually trace it back to 1932. CCMC, the Committee for the Control of Medical Costs, recognized how broken the system was and it needed to be improved. And we've had many, many efforts since then to accomplish it. But what we didn't have was the tool to make it work. And I think of generative AI, and I might keep using the word ChatGPT, but as I say, it's just a name for the category, as being that. Because what it's going to do is empower patients. It's going to give them the ability to actually be able to manage their health. Go to Google and find a link. You'll find a lot of information, what I think of as knowledge, but you can't apply it to your situation. That's going to change. I mean, if you look at right now, some of the tools as part of generative AI, it allows you to paint a picture in the style of Rembrandt, even though you've never had an art course. You can program a computer, even though you've never taken an IT course. You can write a song that sounds just like Drake, and you don't play a music instrument. You're going to be able to manage your own health, your chronic diseases, to know how they're doing, not every 3 to 4 months when you go to the doctor, but every day. You're going to be able to get help at being able to maximize lifestyle medicine. It's going to connect to the wearables and the other devices so you know what's going on with your blood pressure, with your blood glucose, with the other aspects that you have to follow. And when you have a problem, it's the middle of the night, 11 a.m., your child wakes up with a fever, and you're not sure, do I drive to the ER, wait several hours, expose my child to all the other people who are there, or do I wait for the morning? It can give you expert medical device. And inside hospitals, it's going to completely change care. All of this, theoretically, for the benefit of the patient.
This AI, in fact, I've been talking to various guests about singularity when it gets smarter than we are, and that's probably not a stretch. This AI makes it possible for people to access high-level medical information. Is that correct?
More than information. That's the point I'm making. You can get a lot of information, but if you want to know specifically, I am a 60-year-old man who with diabetes, with a family history of heart attack. Here's my genetic makeup. Here are the medications I'm on. And now I'm having some difficulty in my left arm, and I'm worried that is it an athletic injury or is it a heart attack? I can now get expertise. It can advise me very specifically what to do based upon that. And we have a lot of growing examples of where actually this generative AI was as good or better than the physicians providing the care, not to diminish the physicians, but because it has the time, it has the comprehensive information. And by the way, it was judged by evaluators to be more empathetic to what happens in the medical profession today, not because doctors don't want to do it or clinicians don't want to do it. They just don't have the time. And what the generative AI tools will be able to accomplish, and I don't mean the ones today. This technology is doubling in power every 2 years. What that means is that 5 years from now, it'll be 30 times as powerful, 10 years, 1,000 times.
But
It's
we
next generations?
Are we in the process of having AI replace the physician?
That is such an important point, and my answer is the following. It's not going to replace 20% of physicians. It's going to replace 20% of what physicians do today. It's going to take away many of the tasks that can be done reliably, safely by technology, and give doctors back, and now you got to use doctors to mean all clinicians, the time they need to do what they would like to be doing now, what patients would like to be doing now. The average visit, again, I'm using US data, is 17 minutes. You can't take care of a patient with multiple chronic diseases in 17 minutes and go into any depth at all. If the patient arrives With all that being done, now you can start the most important part of that doctor-patient relationship, asking the question, not just how I look in the rearview mirror about how do I take and reverse what happened before, but how do I look to the future and maximize health, avoid disease, allow the things to happen that we all want, both as doctors and patients.
Well, it's again that time when we need to take another station break. Dr. Pearl and I will be right back to continue our discussion. So you stay right there. This is Mission Evolution, www.missionevolution.org. To quote Bob Dylan, how many deaths will it take until we know that too many people have died? This is Mission Evolution, missionevolution.org. With us discussing deadly bureaucratic bottlenecks is Dr. Robert Pearl. His website, robertpearlmd.com. Dr. Pearl, the AI is not where you're talking yet, okay? In what I'm trying to say is we have not reached that level of working with AI that we can get the results, reliable results, that then we take to our doctor. We aren't there yet. Is that correct?
We're not there where I would encourage anyone to use it as a replacement for their clinician. They should be working with their clinician. I'd encourage people, though, to play with it, to try it, to see how much it can accomplish. What we know is that when we give the standard licensing test to a generative AI application, it actually scores in the top 10% of physicians. What we know is when we take the most complex diagnoses and give it to an AI tool against a series of other physicians from the community, it beats them significantly in being able to reach the right diagnosis. But we just can't take the risk of an error at this point. So yes, it needs to evolve more before we can rely on it consistently, but that doesn't mean we shouldn't try to see how much it can accomplish today.
So exactly where do you find this? I mean, I know right now you can Google, what does a heart attack look like? What are the symptoms of this? What are the symptoms of that? Is it something different than that? And if so, where do we find it?
Oh, it's totally different than that. Yeah, I think that what you're talking about is this is the leap forward. So a good example is ChatGPT. It's a free service, by the way, if you want to buy the last version. If you want to spend $20 a month, basically a latte every week, you can have the most up-to-date one. Google's about to come out with its parallel set. It's going to have a free version and a more expensive upgraded one. So people can find this very easily, load it on their computers, on their phones, and use it however they want. They can use it for their writing skills. As I said earlier, they can use it to get expertise in a variety of areas. But medicine is one great example. If they have a problem, they want to know more about it, they want to get educated. It is dramatically further ahead than the browsers you're describing, the kinds of things, the links that you click on and you find on Google.
So years ago, in my father's era, he died several years back and he was just about 100. But he didn't know how his body worked and he had no interest in it. If something would break, he'd go into the doctor and get it fixed. He was an old mechanic, right? But then when you'd ask him, well, what did the doctor say? Oh, I don't know. He said it was something with I don't know. He never knew. And that was pretty much the norm back then. Since then, people have become more educated. The internet's been introduced. And how is that going to help empower the patient rather than them just having to go to a doctor anytime something goes wrong because they don't even know how their body works?
Well, you're raising a very important point, which is the evolution in society. I'm going to guess, I don't know if your father had any investments, but if he did, he relied on a stockbroker. I don't know if he traveled, but if he did, he relied on a travel agent. If he had a situation of needing a new pair of jeans, he went to the store that was in his community or around the block, or maybe it was Sears and Roebuck, whatever it was going to be. He didn't do it all on his computer. In fact, the computer didn't exist, or at least he probably didn't have a computer in his home until maybe the very end of his life.
At which point he had no interest.
But that's all changed. And by the way, we see it in all demographics. We see a difference. TikTok is much more prevalent in people who are far younger, and other tools are much more prevalent amongst people who are older. But we're now in a society where everyone, and I'll say in quotes everyone, has a cell phone, a smartphone, and they use it continually for whatever purposes that are there, and they're going to use it for their healthcare. I think the other thing about it is there was so little that could be done when your dad was growing up, diagnostically and therapeutically, that he would go to the doctor when he had an acute problem and he'd count on the doctor's expertise to accomplish it. But it met his needs. And that, I think, is the key point. It wasn't that he didn't want it, he didn't need it. And now, if it was your dad, he would now face a variety of chronic diseases, multiple medications. He'd be at risk of developing significant problems and not dying at 100, but dying at 60 or 70, or as my grandfather did at 55 from a heart attack. So the opportunity is very different now. And now what your dad would want is more control, more information, and he now has that ability. And again, I keep going back to generative AI or ChatGPT. We can call it what we want because it is so different than both the AI that's come before. The AI before was designed for clinicians. It allowed doctors to use it to read x-rays or to be able to understand the multiple medications that would be given to someone with cancer. Generative AI will be useful for physicians, but it equally would be useful for patients. And that's why I use the word empowerment. You can spend all day on Google and not be able to diagnose a medical problem that came up today. Generative AI will be able to accomplish that. Today, it can do it very well. In the future, we'll be able to do it reliably, safely, and as well as most clinicians.
Do you see, or maybe it's already happened, do you see the smartwatch, smartphone that takes all your vitals and all that fun stuff? Do you see that as being linked in then again with this future AI or the AI that's being developed?
Exactly. These are what's called plugins. So plugins allow you to take data coming off of another device, whether it's a wearable on your clothes, whether it's a monitor in your home, whether it's coming off of your watch, and have that information go into the generative AI system. It can combine with information off of your electronic health record, and it's putting all these pieces together. Understand that what AI can accomplish is how fast it works. So the human brain just can't comprehend the totality of the information. It's just too much. Medicine is advancing, doubling in knowledge every 70 days. What
can
human
believe it.
being can put all that information into their head? But for AI, it's a trivial task. It's expensive, by the way, but trivial from a technological standpoint.
Well, one of the problems that I hear a lot of complaints about, and I personally have seen, is people are getting on this medication, that medication, this medication, that medication. And the doctor sits down and looks at this, but he doesn't know, there's no way he can stay up to date on all the interactions of all the medications at all the time. It looks to me like that's kind of data that AI would just, thrive on.
Absolutely. It's absolutely what an AI could do. And add one more piece to it, which is that the physician may not be aware of what another doctor gave you. I mean, I remember when my dad would go to the doctor, he actually would bring this piece of paper on which he wrote every medication, every change in dose. It was a massive piece of information that he was bringing, handing to the doctor. And what's the doctor going to do with it? As you say, there's no place to put it. The same thing, by the way, with all the information coming off, whether it's a watch or whether it's a monitor. It's my criticism of the industry. No doctor wants to get all this information sent to the office. They're already overwhelmed. They don't want to put it into their computer system in their office. This is exactly the solution that a generative AI tool can do. And it's going to do it all with the technology that already exists. It already can handle this. It's what's called a large language model. It was trained on the entire corpus of the internet, textbooks and journal articles, everything that's out there, and it continually gets updated on that information, and it doesn't have any difficulty handling it. I've heard people say that the amount of knowledge inside a generative AI application is above the sum of knowledge amongst all humans on the planet today.
Yeah, we're getting close to singularity for sure. I mean, it's moving so rapidly. The one thing that I've seen in healthcare just recently in our area, probably the last few years, is now the doctors, they don't look at you, they look at their computer and they have to find the insurance codes and they're spending all their time, and it aggravates them to death, is spending all their time on the computer. But what that's doing is entering it into a database that your chart is electronic. And then when they refer you out to another doctor, they pull up your chart and there's all that information. Is this going to be able to be faster, be improved, help people stay on top of it better even than it is now?
Well, let me make one correction. And again, I'm speaking about the United States right now. When you go see another physician, they rarely can access the information in the first physician's database. In
Oh, I'm
fact,
sorry. Yeah, this was all in, what do they call it? Not in house, in system. It's all within the system that everybody belongs to.
yeah, if it's a single system that sits there. But the reason I'm saying that is the most common way that doctors communicate vital patient information today is the fax machine, a 1834 invention. So to give people a sense of where it's going to be. But your answer to your question is yes, this is exactly what's going to happen because it has the ability to bring all this information together, to organize it. If you actually go inside electronic health record, and I know the clinicians listening in will know exactly what I'm talking about, so much of it is copying and pasting. It's a massive amount of words, but not a whole way to understand it all. A generative AI application is superb at reading through all that material, organizing it, and presenting it. Try and think of the doctor's visit rather than starting where it starts today, starting where it ends today, and now moving that much further ahead, being really able to address what's going on in the patient's life, maximizing the relationship between the doctor and the patient, talking about health, talking about ways to avoid disease in the future, not just treat it when it arises. It's an entire new world. I've labeled this healthcare 4.0. Healthcare.
So,
Sorry, go
so
on.
we spoke about, everybody, particularly with AI, there's a huge range of people that don't even have a smartphone, okay, nor do they wouldn't know how to run it or a computer. And that's, getting less and less, up to the people that are just really whizzes on it. So it looks to me like it's going to be very variable how many people are going to be able to use this accurately. Is that correct? And if so, how do you fix that?
Well, actually, the overwhelming majority of people have a smartphone. They may not have used it for this particular application, but one of the beauties of generative AI is it's very straightforward. And I predict very soon it's what's called multimodal. You'll be able just to talk at your phone, have it record what you're saying, and give you back information directly. So
Fantastic.
yes,
We're
there are some people that we have to educate and train, and that I
and
think is what we should be starting right now. It
we're
should be a
going to we're going to have to take a station break and pick up with us on the other side. Sorry, we ran out of time in this segment. Dr. Pearl and I will continue to explore the present and future of healthcare. Stay with us. This is missionevolution.org. How to mend a broken system. This is Mission Evolution, missionevolution.org. We're continuing our discussion with Dr. Robert Pearl, his website, robertpearlmd.com. So, we've been talking about how AI can really help medicine in the future, but what are some of the current downfalls of AI in medicine?
the current downfalls are problems that are constant and ubiquitous inside technology. We have issues of privacy and security, people hacking into systems, extracting information from it, people wanting to know more about you so they can manipulate you through various advertising schemes. We know there's some bias built in, but it's not the bias of the technology, it's the bias of the data set it's trained on. It's a classic example from United Healthcare of wanting to provide more care to the sickest of patients, but because Black patients received $1,800 less a year of care, even though they were very sick, they were under included in the work that was being done. So there's problems that are there. And then, of course, misinformation. This is a very powerful technology. And like every powerful technology, it can be used for bad purposes. So there's a lot of challenges. And as I say, it also needs to have a couple more generations so it becomes more powerful than today. But I'm less worried about those issues because I think the excellence of the programmers and the number of people working on the problem is going to minimize it. What I'm much more concerned about is whether the healthcare system is going to be able to evolve in a way to use it. And what's interesting to me, we talked earlier about chronic disease and the problems that exist. If you're going to solve the problems of chronic disease and you're going to make care more affordable by making quality better, there are changes that need to happen. It's the same changes as you would for generative AI. You've got to bring people together in groups. The idea of the single doctor working alone, like your dad might have had growing up, it just doesn't work with chronic disease and multiple diseases. It doesn't work when people have a life expectancy into the 80s and 90s rather than 50s or 60s when his parents were alive. You need doctors to come together and work collaboratively, and that does not happen very many places outside of a few healthcare systems. And you need to change how you pay them. You can't pay them fee for service. All that does is increase volume. Charlie Munger, who had been Warren Buffett's partner, said, tell me your incentives and I'll tell you the outcomes you're going to get. Pay people for volume, you can get more volume. That's the way the system is designed. But if you want better outcomes, pay people around value, around preventing disease, avoiding complications, achieving the best outcomes, better patient safety. These are the kinds of things that doctors would like to do and patients need and want and deserve, but the system is not designed around that. So I think it's going to be technology plus the doctor and the patient and an evolution of the system. And it has to happen soon. If not, the crisis of today will only get worse.
And it'll get worse rapidly, won't it?
Absolutely.
Yeah,
it is getting worse rapidly. We're in an accelerating phase. We've reached the end of shrinkflation. You just can't afford any more out of pocket. You just can't afford to have more steps necessary for prior authorization. You just can't have care being cut back anymore. This crisis is about to evolve. The United States is predicting $3 trillion more of spending by the year 2031. I think we could spend $3 trillion better than just continuing the way we're doing things today.
How big of an upset is it going to be to revamp the faulty system at this point?
I think it's going to be a very difficult transition, but at the end of the process, I think it's going to reduce the burnout that clinicians feel today. It's going to allow them to do their job easier, to do what they want to do. They want to have a intimate and intense relationship with their patients. They want to be able to keep people healthy. They like it when people come in and say, doctor, I'm doing great thanks to the work you and I have done together. Thank you so much. That's why they went into medicine. It's going to bring back mission and purpose, but getting there. I often tell people it's a little bit like looking across a canyon. The other side is only 100 feet away, but the path there is a very complex one. And that, I think, is going to be the biggest challenge. And one of the things I'll tell listeners and viewers is I'm hoping it's going to come from inside the American healthcare system. But if it doesn't, what we're already seeing are the large retail giants, Amazon, CVS, Walmart, who are acquiring medical groups. Walmart now has a deal with United, and it's 90,000 employed physicians. And if it doesn't change from inside medicine, it will change from outside. A problem that has to be solved, that can't continue, will be solved by someone. And only time will tell whether it's solved, as I hope, from inside medical care. But if not, it will be solved from outside.
So I'm sure at this point, the audience is wondering, okay, I'm one person, but what can each individual do to push this along in the direction we want to see it going?
First of all, I think that every individual has to recognize that they're on the verge of being empowered. And part of being empowered is becoming educated, becoming skilled, becoming experienced. And so I'm going to encourage them to start trying the system. The more you learn to provide the prompts, the better you're going to do. I think number two, they need to focus on their own health. We have opportunities today through exercise, through diet, through meditation, relaxation, to be able to improve American health. It's hard. People are working long hours. They have family obligations. But if you love your family, save your health going forward. And then I think the time has really come to be able for individuals to join up with others, to speak to people during the election cycle, candidates, to make sure they're moving forward the agenda around health, and to be able to be more educated. This is $1 out of every $5 we spend. When we go to the grocery store, we worry about a few dollars here and there. This is a massive amount of economics and finances for families, for communities. I think it just has to be elevated. We can't expect someone else to solve it. It's not going to happen by the insurers. It's not going to happen by the drug companies. It's not going to happen by even the government. It's going to happen because people demand it, push it, and then we have no choice but to have elected officials respond to it.
This is about the time in the show, Dr. Pearl, when I get to ask, what is your mission?
My mission is to transform American healthcare. You know, as I said, I trained as a plastic and reconstructive surgeon, fixing kids with cleft lip and cleft palate. I had 10,000 patients. I knew them all well. I loved them well. Gave me tremendous fulfillment. I then went on to become the CEO. We're now responsible for 12 million people across the United States. I didn't know a large percentage, obviously, very well, but I knew what was happening everywhere. I had a modicum of control that I could use. And now I want to change first the 330 million Americans, and then hundreds of millions in other countries, because the problems are the same. The specifics are a little different, but the outcomes are still quite problematic for patients around the globe. And that's my goal right now. I think if I can bring together a diverse group of individuals committed to improving health, who recognize the problems that exist, but also see the opportunities through technology, through integration of care, and encourage people to step forward and be leaders, whether you're a patient, a clinician, or the CEO of a company. If we can do all those things together, I think we can solve this and make the United States, the world, Canada, all the countries listening in better places, healthier places to live for themselves and for the next generation.
Beautiful mission. I understand, by the way, that your books, you don't take the proceeds from your books. Where do they go?
No, the proceeds from the profits from all the books go to Doctors Without Borders. This is a remarkable global organization, obviously a not-for-profit, that goes to wherever the problems occur, an earthquake, a tsunami, or a civil war, and provides assistance in an apolitical fashion, in a not-for-profit fashion. It's an organization I've supported throughout. And when I wrote my first book, I dedicated all the profits to Doctors Without Borders. I did that for my current book, and I'll do it with my next book.
That's beautiful, beautiful offering for a beautiful service. So we're close to the end of the time in the whole show, but how soon do you see this AI that we can use as individuals being available? I mean, it's somewhat available now, right?
It is available right now. It's not as good as it has to be, but again, I think now is the time for people to experiment with it. And again, I want to make the point: all of the AI to this point has been designed around the providers of care. The new technology is also available, utilizable, helpful to the recipients of care. I think we're going to see something in the 5 to 10 year range when this thing really happens. Because as you've so well brought out, there are many changes that need to happen. We need to change the structure, the way clinicians relate to each other. We need to change the financing. These are things that don't happen in a single day, but they could happen over a 5 to 10 year period. It's going to take that long for the people outside the industry to either enter in and take over, the ones inside to make the changes to happen. I think it's going to reach its resolution somewhere in the next 5 to 10 years. But today, now is the time for people to begin to experiment, take the chance, take the opportunity to improve your health. Figure out how you can prevent diseases, if you have chronic diseases, how you can avoid the complications from them, the heart attacks, the strokes, the cancer. Figure out how you can make yourself, your family, your loved ones all better. This is the mission and the purpose that we're all on as human beings, and technology will be a fabulous partner with us. The doctor, the patient, and the technology working as one has the opportunity to propel medicine forward.
And that's probably the only opportunity we have, really, because it's too complex at this point, isn't it?
And if not, what we're going to see is progressive erosion. We're going to see rationing. We're going to see greater problems with a negative downturn in longevity. With the advances in medical science, it should be the golden era.
It
And
should
instead,
be.
I think it's one of the most difficult ones for both the providers of care and its recipients.
Well, that magic moment has arrived. We are out of time, Dr. Pearl. Thank you so much for coming on the show.
My pleasure. Thank you for having me.
It's my pleasure. Our guest this hour has been Dr. Robert Pearl. Dr. Pearl currently is a professor at the Stanford Medical Business Schools and the author of 2 books on healthcare, Mistreated and Uncaring. To find out more about Dr. Pearl and where you can find his books, visit his website, drpearlmd.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy past archived episodes, visit www.missionevolution.org. And please be sure to join us right here next time. This mission will continue, bringing information, resources, and support to our evolving world.